So hi everyone. There's been several wonderful talks about competencies before on this one, so please bear with me for another talk on competencies. And thank you for inviting me to give this talk. I'm Dusanka Nikolic. Thank you, Russell, for your introduction. And I will be presenting on behalf of the team who took part in this work. Some of them will be listed on the last slide, and the sort of core team is listed here. And we'll be talking about the development of a pathogen genomics competency framework for different roles in healthcare and public health, clinical health, public health, and research. So so it moves. Just to give it a bit of a context, so the pathogen genomics competence framework that we've developed was part of a T3 Connect project, UKRI funded project that under the title Data Science and Genomic Pathogen Surveillance Training Program. And it was a collaboration between the institution I work for, Wellcome Connecting Science in Kingston, in Cambridge, and Center for Genomic Pathogen Surveillance, formerly part of the Big Data Institute, but now part of the Pandemic Sciences Institute in Oxford. So T3 Connect project had several objectives. One of the objectives was to design, develop, and deliver trainer-trainer courses with the aim to strengthen capacity for pathogen genomics tailored for research and healthcare professionals. And as part of that, we've developed different resources and education tools, and among other things, this competency framework I will be telling you about. Just to say that my part in the development of this framework was from the educational and sort of conceptual and kind of methodological point of view, so the talk will more have that kind of aspect. Okay, so what was the motivation to develop this framework? Doing a bit of needs assessment and the literature search, and also looking at several other frameworks, existing frameworks, it was clear that the knowledge and skills related to pathogen genomics need to be integrated into different roles in healthcare, and just to kind of enhance or replace existing tasks, and to eventually support like clinical decision making or surveillance, pathogen surveillance, and then to efficiently kind of train professionals in those skills and knowledges. The training would ideally be based on a framework that is flexible enough so that it can be tailored for different roles, but also comprehensive enough so that the roles along the genomic pipelines from end to end, from beginning with samples all the way to decision-making, different roles can sort of speak each other language and interface in a better way. So also such a framework would need to accommodate the rapid evolution and development of pathogen genomics as a field as well. So this is a top-level overview of the design that we've done for the framework. And as I explained, we had trainer-trainer courses within the T3 project that were attended by experts in research, clinical and public health, and a majority of them, I would think, also were involved in training or capacity building. So this empirical setting provided us with an opportunity to collect the initial data and to develop the kind of initial draft of competency framework, which, as I mentioned, looks at knowledge, skill, and attitudes related to pathogen genomics from end to end, from sample collections all the way to analysis and interpretation. So the knowledge would cover biological, clinical, public health subjects related to pathogen pipelines, skills such as sample collection and skills related to analysis and interpretation of data, attitudes such as best practices used and continuous learning, etc. So these are the steps that we've applied, and then after this I will illustrate a few steps. After establishing the purpose of the competency framework and identifying like the key audiences and main stakeholders, we've then identified the core competencies topics covering biological, genomic, and data science topics, and categorized them into 8 domains, 6 of which are related to the actual pathogen genomics, and then 2 are related to the integrated so-called or professional skills and some basic training skills as well. And then after that, we've developed and distributed a survey among the healthcare and research professionals that attended our courses. There were 90, to self-assess the proficiency for specific domains and specific competencies using Bloom's taxonomy, and I'll come back to that as well. So just an illustration of the domains and topics in the survey and the questions that our professionals were asked about to describe the role, professional role, to look at the competencies listed, and to use the Bloom's taxonomy to assess the proficiency level. After we've collected the data, we've kind of extracted the personas from the data that we had and defined a set of personas. So we looked at the job descriptions and to confirm the role and tasks related to genomic workflows. And then for these personas that kind of sort of repeated in our audiences and we were able to identify them, for each persona, we calculated the model frequency of self-reported proficiency levels. And that gave us an initial indication of the proficiency level for that specific persona, for that specific competency. That was then fed into the discussion that was through consensus building on the kind of ideal or adequate proficiency level. So we went then a step further and defined and described each competency in detail as a statement that includes knowledge, skill, attitudes. We called it internally KSA data set or database, which contained all the competencies, the whole list of competencies along the Bloom's levels. And so that helped us to not only describe better our personas that we've had extracted from our audiences, but also will help, we hope, in definition of describing of new personas. And I'll come back to that as well. So this is an example of one survey, two responses by 2 professionals, what they were asked, job title, role description, then one domain, and then several competencies in that domain. And then using Bloom's taxonomy, deciding on the proficiency level. So, So we've used revised Bloom's taxonomy, which is an educational tool validated in many studies in the past, since the 50s when it was created by Bloom. We are just using the cognitive part of the whole taxonomy. And it was validated and it was used in practice, and it turns out to be a useful educational tool, especially because of the structured way that allows trainers, educators to organize and define learning outcomes, educational objectives. So it also fits very well with the kind of outcome-based design of training and courses which we use, and it's widely also used in this community. This is an example of how we looked at while having discussions and consensus building at different. We looked at the job title or description. This is an example here. We looked as well at the action the actual person performs on the data flow, from data generation, analysis, reporting, interpretation to use. We would decide where it falls, and through consensus, the persona would be categorized as, for example, here by biomedical scientist. This is an example of the bioinformatics persona for a specific competency on genomics, genes, and genomic variation, and then calculating the mode, which indicated that evaluate can be the proficiency level for that competency for that persona. And here is a part of the data analysis where we can see now defined persona, calculated the mode, as I mentioned before, which then feeds into the discussion for consensus building. In this case, for these specific competencies, the consensus outcome coincides with mode, but it wasn't the case in every, we had multimodal cases, and we had consideration of job description and then concrete context in which this professional works, etc. So we took that into account in discussing. And so why we use consensus outcome, consensus approach? So this is something that is normally used when you want to reach a certain level of agreement among the stakeholders, a number of stakeholders whose views and perspectives you want to include. And apart from that, consensus method is also used when to actually correct for the lack of the kind of complete knowledge about something. So in this case, the knowledge and skills is kind of distributed in pockets, like it's within our experts who came to the courses or within the consensus group, the core group that did the consensus building, etc. So we tried to access the relevant information and processes, and through this framework, bring it back to the practitioners. Relevant data, information. So the knowledge, skill, attitude database that I mentioned, we've developed. We've described each competency along the Bloom's level, and ended up with like more than 350 different statements. Is something that is really, we're hoping, a heart of this framework. And as you can see, we are going through Bloom's levels, using appropriate verbs for each level. But what we try to avoid is repeating similar statements for the different Bloom's levels and just kind of changing verbs. We try to capture the actual development of the knowledge, skill, or attitude that comes when you move from the level of remember to all the way to the higher cognitive skills such as evaluate, create. So hopefully we are reflecting that evolution of the knowledge, skill, or attitude by describing it in this way. So actually this, as I mentioned, this database is the heart of the competency framework, which will allow new personas to be described, because it also allowed us to describe our own personas, which are here listed here. in more details, but also it will be useful for other contexts, we are hoping. And once the proficiency levels for a certain persona can be decided, and for that we do have a survey and a methodology of how that can be done, then the competencies can be retrieved for this, from this database. So just for the first part of the talk, just to summarize the competency components of the framework, we have a list of 60 competencies, and then we have a survey tool, and then we have the database that describes all the competencies along the Bloom's levels, and then we have our own personas, which are based on the mostly UK and Ireland data. We are currently, okay. Yeah. That's okay. I mean, shall I finish, or I have, I think, 2 more slides.
Yeah, we're in the question.
Okay. So we are currently open for validation and of the competency framework, and the validation will consist of looking at, first of all, clarity and accuracy of the competencies, and then how they are transferable into different contexts. Then we are going to work on the implementation plan, including a portal where the competency could be retrieved and supported by training and guidance on how to use them. And on a longer term, we're looking at monitoring and evaluation, hopefully to accommodate these rapid changes in the field. And we are inviting the community to help with the process of validation. And hopefully this can also serve for the future as a basis for an assessment framework, which ideally would be also a community project. Thank you all very much for listening. This is my email if you wanted to ask or request anything, please write. Thank you.
Thank you. I think we have time for a question or two.
Yeah, Dusanka, it's great to hear that there's also one going in that direction. So I wanted to ask you whether you have used other frameworks to build this one and to get inspired about this one, and if so, which ones?
So yes, we've looked at different, I mean, our audiences were kind of specifically UK and Ireland. So we did look at the different NHS competencies. We've looked at the European Center for Prevention of Disease, Control and Prevention, that they have epidemiologists, for example. We've looked obviously at ISMB competencies, which we are all in the group familiar with. But we were aiming for something that's, as I explained, tailored more for the healthcare professionals, public health professionals, researchers, and yes, within pathogen genomic skills, knowledge, skills, and attitudes.
All right, thank you. We've got one question here.
Thank you, Dusanka. I was a bit flabbergasted when you mentioned 60 competencies. When what I hear from the other speakers is that they took, when they were dealing with the ISMB one, they actually proved it down in a way. Can you comment on that? And
yes, I mean, they are probably a bit more detailed than I can't really compare straight away, but there are six of these domains contain competencies that are pathogen genomic related, and 2 domains are like dealing with professional and training competencies. So altogether, it's quite a comprehensive framework which covers all the knowledge, skills, and attitudes from the beginning of sample collections all the way to decision making. I'm not saying all the competencies are relevant for all the personas present that we have or future, but it is good to have this more comprehensive framework in order to have a bigger picture and make the interface between the professionals along the pipeline easier, so that they kind of speak each other, can speak each other languages. We were aiming to do that from start, so it develops into 60 competencies. I know it sounds a big number, but yes, as I say, not all of the competencies are relevant for all the roles, but it gives the flexibility to create new roles out of those. So let me see if I can. Okay, to stop now. Okay.
Sorry,